again. I'm Dr. Tan Iping, consultant obstetrician and gynecologist. Today, my live video, our regular live video at 9 p.m. will be regarding something very light and easy, but something really common and annoys many women as well. And many women live with this problem for years and do not know how to solve it. So we're going to talk about vaginal discharge. So today's topic is vaginal discharge, something that affects many women. And if you have any question you want to ask, feel free to ask. Before I start, let's just share it with everyone first. Let's share the video and like the video session on vaginal discharge. Okay, I'm sure this problem affects many of you out there, and sometimes you may be even too shy to even look for a doctor to talk about it. Okay, vaginal discharge is something that every woman would have at certain point of their life. But how to differentiate between normal vaginal discharge and not normal vaginal discharge? So first of all, normal we always define as number one, is either clear or white. Number two, it should only come out mainly during your ovulatory period or shortly before your menses. Because women have more discharge during ovulation, but the ovulation one is usually the clear color watery discharge, and as you go towards your period, then it becomes more whiter, but opaque and white, but it's only white. So what is abnormal discharge? So abnormal discharge, number one, is the color. So abnormal discharge can be yellow, can be green, can be brown, can be pink. So if you see color in your discharge, that means it's not clear, it's not white, it has other colors like yellow, green, brown or pink, then you know that is an abnormal discharge. Okay? And another thing we say about discharge is, if it's a normal discharge, it should be just a discharge. You should not have any foul smelling discharge, and it shouldn't be itchy as well. So these two things, no foul smelling, no itchiness, and yes, no pain. So no pain, no itchiness, no smell, and only white or clear, that is normal discharge. So now you know whether you're having a normal discharge or not. Most women, if they are normal, normally we would say that most women should not see their panties wet or dirty every day. No, normally it's only during ovulation, then you get the discharge that can wet your underwear or the week before your menses. The rest of the time, your underwear should be dry and clean. So that is normal. But having said that, a lot of women, I know many of you be thinking, no, not me. I have discharge every day. So am I normal or not? So basically, we still go back to clear and white discharge, no smell, no itchiness, no pain, that can still be normal. Okay, so let's talk about normal discharge. Why do some people get normal discharge more during certain time and some people don't? Okay, ovulation is a time where you release a lot of clear color discharges. So that is during ovulation, and it can wet your underwear. That is very normal, and in fact it's telling you that that is your fertile time. If you want to have baby, that should be the time that you should have sex with your husband. But other than that, premenstrual, again you have the white thicker, it's a bit more opaque, white and thick type of discharge that is before your menses. But there are people who have normal menses but more during what? Number one, when you're pregnant. Pregnancy, you have a lot more discharge one. And if it's clear and white, that is considered very normal. And other than pregnancy, there are some people that naturally they produce more discharge. When you look at them, they just have everything that's bigger. Some women, you have small uterus, big uterus, small cervix, big cervix. Because cervix is one of the organ that releases all these discharges that is influenced by your hormonal cycle. So you have small cervix, you have big cervix. Bigger cervixes tend to give more discharge, but again, most of the time it's only white or clear. So most important thing is the color of the discharge and whether you have any other things that comes with this color of discharge. If it's not that, then you need to think about what's your problem. There are few what do you call that, distinct things that you need to take note. Number one, why people get discharged? People get discharged due to two reasons. Usually two reasons. One, we are talking about abnormal discharge, okay? So one is due to infection. Second one is due to growth, tumor, cancer. So you get discharges due to two reasons. So you can either get discharges due to infection or because you have some problem with your cervix or your uterus that is releasing a lot of discharge. So let's talk about the common thing first, which is infection. But infection, there are many types of infection. You have the commonest that everybody talks about, which is Candida. Candida is a yeast infection. It's very common. You do a Pap Smear, you get the word Candida in your Pap Smear, or some Pap Smear reports it as yeast infection. So Candida is one of the infections that we need to think about. Number two, some bacterial infection. But bacterial infection can be vagina or cervix. So you see, vagina usually is Candida or bacterial infection. But when it comes to cervix, it can be bacterial infection or viral infection. So we have to differentiate what it is. But is there any difference in your discharges? And yeah, many of you talk about antibiotic, probiotic, but you must understand the principle. It doesn't work for everything, because number one is you must know whether it's Candida or not. Candida is a very common infection, which is fungal. Fungal, yeast, Candida, it all means the same. Bacterial infection is totally a different story. Viral infection is a different story. Okay, let's go one by one. You can have infection of your vagina that gives you discharge. You can have infection of your cervix, and also you can get infection of your uterus and your fallopian tubes that give you discharge. So all of them are not the same. Okay, I'm going to start with vagina first, because vagina is very common. The infection of your vagina usually is either Candida or bacterial infection. And typically, because vagina is down, is somewhere outer, so it can cause a lot of other problems like itchiness, smelliness. When you have itchy and smell, it is all due to vaginal infection. Usually lah, it can also be due to cervix, but usually it's vaginal infection. So the vaginal infection can be due to Candida or other bacteria. Other bacteria are like what? E. coli, GBS. The common ones that we always see is E. coli and GBS infection. So bacterial infection is bacterial infection. Candida is Candida. You can also have BV, we call Bacterial Vaginosis. So you see from the name of the thing is already Bacterial Vaginosis. So it's a vaginal infection with bacteria. So, and all these are, again, we have to categorize it as two separate things. One is an infection that comes because of something wrong that you do, and one more is an infection that really comes because of infection. You understand? So you got infected by E. coli. E. coli is not supposed to be in the vagina, but you have E. coli in your vagina, so you got infected by E. coli. So all these infections usually come from where? Okay, E. coli infection is usually from your feces, because it's commonly found in the feces. So sometimes it's due to contamination, especially in younger children. So I do see little girls brought by their mothers to see me because they have discharged. Usually young girls, maybe about 5 years old, 6 years old, 7 years old, 8 years old. Usually it's around that age, because that is the age where you let your daughters do everything themselves. They go to the toilet themselves, they clean themselves, they do everything themselves. So they can accidentally, when they clean, when they go and pass motion, they clean, they may accidentally contaminate their vagina with feces from, when they pass motion. So that one is one. Okay, but all those things are also relatively rare. So let's talk about Candida. Candida and BV, these two are exactly the same type of infection. Candida is fungal, BV is bacteria, but they all come because of the same reason. One, you need to understand that our vagina has a protective layer that covers the entire vagina. You must understand that God or nature has already pre-planned everything for us. They know there's no way a woman can keep a vagina clean. Why? Because you are going to have sex. And when you have sex, things are going to enter. There's so many bacteria and fungus that will come in together with your, when you have sex. So our body already on its own create a protective layer that protect the entire vagina. And this whole protective layer consists of bacteria. What we call them probiotics is because they are considered good bacteria. They don't cause you harm, but they are still bacteria. So these bacteria cover your entire vagina. But if you do something to spoil it, and which is very common, that's why Candida and PV is very common among the women. Why? We like to spoil our protective layer. Why we like to spoil our protective layer? Number one, we like to be too clean. That's why I sometimes ask women when they come with Candida, I will ask them, are you generally clean? So if they tell me, yeah, I'm very clean, they'll be very happy and very proud to tell me, yes, I'm very clean, I always take care of my cleanliness, I always make sure I'm clean. So when you make sure you're clean, that's when you get your Candida and your PV. So one of the commonest mistakes of women is that they become very clean, very hygienic. They always find that down there is so dirty, so they need to clean, they need to clean. After they have sex, they wash, they bathe, they wash, they go toilet, they wash. Washing is not a problem, but it's how you wash. What do you do when you wash? Do you just take water and rinse? Or do you spend the next 5 minutes washing with water non-stop? Or are you going to use soap or feminine wash? Your Lactacid, all kind of feminine wash out there. Or are you going to, there's some women who will take the water and spray into the vagina. After they have sex, they want to spray all the water, all the semen out. So they want to keep things clean. But when you keep things clean, you also got rid of the natural protection that you have. So I'm not saying that you cannot be clean, but you need to look at how clean you are. We do not want to go to an extreme. I know now with COVID-19, everybody are trying to be clean. We wash our hands so many times a day with soap, not just with soap. We wash our hands with antibacterial soap, antiviral soap, antiseptic soap. I have also a lady who never had any of such problem until recently because of MCO. Why? Because the husband bought Dettol for them to bathe now. Can you imagine? You use Dettol. I know Dettol has shower gel, right? So now you want to kill all the germs. You buy Dettol to bathe and you use Dettol to wash your private part. Yeah, you wash off all your protective probiotics because Dettol doesn't know who is good, who is bad. Dettol only knows kill everything. Okay? So when you kill all the good bacteria, then your fungus will come because Dettol cannot kill the fungus. So then you have a new infection. And people will ask, where this fungus come from? I say, it's from your body because our body has Candida. But the only difference is it exists in very small amount. But when you wash everything off and you do not have any more protection, then it keep growing, nothing to protect you, so now can grow a lot. So you need to be careful with how you clean your private part, okay? Do things in moderation, don't be too clean. So that's the first thing that a lot of women did wrongly. Of course, some things that you do are a bit more extreme that even definitely can kill all the probiotic. Number one, Some people even do douching. You know, they buy the bottle with a tube where they push inside and they flush all the water inside. And when you look at all the douching that is available in the pharmacy, some are really, you know, anti everything, bacteria, everything kill, finish one. That's why the infection never ends. But these women typically tell me what? They tell me that I feel better after washing. Of course you feel better after washing because you get rid of everything when you wash. Including, you get rid of what? You get rid of even the fungus, the candida, everything you get rid because you wash so cleanly, right? But you have no more protective layer. How leh? Then candida is going to come back. There's no way you can get rid of all the candida in the world. So that's why there's no end to it. That's why typically people with candida, very typical. They go and see a doctor or they go and see pharmacy. They get certain medicine. They get well for 1 week, 2 weeks, and it comes back again. And then they go and see doctor again. They go pharmacy again. They buy medicine. Then they take the medicine or insert the medicine, and then they get well for 1 week, 2 weeks, and it come again. It keeps coming again. It's because the problem is not solved. The real problem for candida infection or BV infection is the protective layer. Okay? So, how to know whether you have candida or BV? Very easy. Candida is itchy, BV is smelly, but they are together. If you're itchy and smelly, you have both because they are together. They like to be together. You can have either one or both. So the first mistake is too clean. Too clean, too clean, too clean. No more, okay? Don't clean yourself so well. Number 2 is panty liner. Oh, panty liner. That's why I always say, 20 years ago, no feminine wash, no panty liner, no candida. Now we have so much problem because you all use feminine wash and then you all use panty liner. All these things are commercial, all these are scam, you ask me. Because why? When you put a panty liner inside, what is going to happen? You're not just going to keep everything there, you're going to keep everything there. You're really going to keep everything there. Your private part is going to be humid, good environment for candida to grow, good environment for BV to grow. So now you are actually having a good area for them to grow. Now you encourage them to grow. So don't use panty liner the whole day. I know many of you wear panty liner 7 days a week. No, panty liners is only for what? It's for maybe the last day of your menses, but not 7 days a week and not 30 days a month or 365 days a year. Why I call this scam? Because you think about it. Why you put panty liner? I always ask, why you must put panty liner? Doctor got discharge. I cannot stand the discharge, so I put panty liner. So you put panty liner, then you grow more discharge. You feel clean because you have a panty liner there, right? But then you got more discharge. Then the more discharge you have, the more you need to use panty liner, the more you need to change your panty liner. Don't you think it's a good business gimmick? It's a scam. And you know about washing, feminine wash, also the same thing. A lot of women, they thought they used the wrong thing to wash, that's why they got discharged. Then they buy feminine wash, and then feminine wash makes you feel good, right? But it comes back, the infection comes back. Every time the infection comes back, you use the feminine wash again. You keep using the feminine wash, but your infection cannot go away because you use the feminine wash. It only makes you feel better for maybe 3 hours, 4 hours. Then you're back to square one. So these are business scam. So throw those things away. Don't waste money on panty liners and feminine wash anymore. Okay? 2 things you need to know. Number 3, another one more mistake that a lot of women do. That's why I always tell a lot of women when they get candida infection or PV, I always tell them simple. You're either too clean because you overwash and you keep putting panty liner because you cannot see the discharge on your panty. Or you're too sweet. You're too sweet. If you ask people who are diabetic, they'll tell you they have discharge the whole year because they're sweet. But once they control their sugar, the discharge go away. So you're too sweet. Why? Why is sugar a problem? Because you may have some amount of sugar in your urine at times. Not necessarily a whole day. Some of you, if you really check your urine every day for sugar, on and off you will see it. Oh, your sugar in your urine. Yummy, yummy, yummy. Candida loves sugar. You give him food. You give Candida food. You give the bacteria food. Yummy, yummy. They grow more. Okay? So makes sense? So if you have Candida or you have BV infection, long term, first thing first, no medicine is going to cure you unless you change your lifestyle. I have women who tell me that, Doctor, I cannot get over myself. You ask me don't wash myself, I cannot, because some women, they're just so clean. I can't help you. Okay, you have to stop it. So number one, only wash your private part with water. Okay, no soap, no feminine wash, no douching, no antiseptic, no Dettol, please. Okay, only water. And don't use too much cleaning as well. Meaning, even though you use water, but maybe you spend the whole time cleaning. Oh, don't lah, don't spend so many minutes cleaning. If you go to the toilet, just rinse it and dry it. That's it. If you need to wash, if not, if you just dry it with tissue, to me it's fine. But some of you will definitely use water to wash. No harm. Rinse it. Just splash water and dry it. Don't wash like as though you're taking a bath in the toilet. Okay? And when you bathe, same thing. Water only. No soap. No shower gel. No Dettol. Okay? Please. So keep yourself moderate in the way you take care of your hygiene. That's number one. Number two, don't use panty liner. Okay? Throw it away. Throw it away. Alright? Don't use panty liner. So I don't know how much some of you buy panty liner. To me, I buy one pair of panty liner can last me one whole year, so don't know can finish or not. Why? Because you need to use it for the last day of your menses. You don't use it every day, okay? Alright, so these are the two things you need to do. And number three, take care of your diet. If you think you may be diabetic, you normally don't check your sugar, and you get this Candida infection so frequent, maybe it's good to check your sugar, okay? For people who regularly check your sugar, you know your sugar is normal, that is fine, but still you need to take care of your diet. Don't overtake too much sugar, okay? No sugar. Take care of your sugar. No bubble tea, no cakes, no chocolate, no ice cream. I wouldn't say no, but keep it to the minimum, alright? Keep it to the minimum. That would help. Okay, so I finished the first part, which is Candida and BV, which is the main problem that most of the women have. Okay, then we will go to other form of infection. So just now I'm talking about bacterial infection and fungal infection in the vagina. So usually their symptoms is they are discharged, but they are usually yellow or green, or they can be, if you don't have yellow and green, but maybe it is itchy or smelly. So when you have all this, then you're thinking about vaginal infection. Okay, now we go into the cervix. You can have cervix infection causing discharge. Cervix infection also give you discharge, yellow-green discharge, yes. But something about cervix infection, it can also give you smelly and itchy also, you know, just like the Candida and BV. I will tell why. And third, it can also cause blood. You can also see blood in your discharge. It can be like blood stain. Some people, they tell me they got pinkish discharge, or when they see the discharge, they can see little lines of blood. You know, your discharge may be white or yellow, and then you see little blood in your discharge. When you see this, then we know. If you have blood in your discharge, then we know it's definitely not vaginal already. You see, the rest we can't tell the difference, because vaginal or cervix, same. You can have yellow, green, you can have itchiness, you can have smelliness. You can't tell the difference. But the moment you see blood in your discharge, then everything is higher up. It can be cervix, it can be uterus, fallopian tube. Okay? So, cervix usually can be either only bacteria, virus, or parasite. Now you're three. No more Candida. Cervix, no Candida already, no fungus already. So it's bacteria, viral, or parasite. Parasite is the only one that gives you itchy and smelly at the same time. So if it's cervix with itchy and smelly, then it's parasite. But you can't tell the difference, right? You need to see a gynae to tell the difference because you can't see your vagina or your cervix inside. But that one can give you itchiness, and that's why a lot of people got it wrong. I have seen a lot of women, they got parasite, but they don't know. So what happened is that they actually went to pharmacy and they say, I got a lot of discharge, very itchy. So typically pharmacy will give you a pessary, you know, those little tablets to insert. Insert doesn't get away, it doesn't solve your problem because parasite, different medicine. That thing is not going to help you. You can take whatever probiotic, it doesn't help you because parasite. Parasites are like worms, you know. This thing we call Trichomonas is really like a worm. You got a tail, you can swim, you can swim inside your vagina. Okay, so you need to see a gynae to know what it is, okay, to be able to tell the difference. So other than parasite, then is virus or bacteria. Virus is usually HPV lo. Everybody talks about HPV infection. HPV infection seldom give you so much discharge, but sometimes can. Or they tend to give you blood in your discharge, or they give you bloody discharge after when you have sex. Not every day, but sometimes you won't know at all. That is why HPV causes cervical cancer, and most people don't even know because they thought their discharge is normal. But it can also give you a little bit more discharge, but their discharge usually not a lot. And if you're lucky, you may see some blood, so at least it tells you early. But not everybody is so lucky, okay? So, and last of all is bacterial infection of the cervix. And when we talk about bacterial infection of the cervix, usually we are talking about things like chlamydia, gonorrhea, ureaplasma, mycoplasma. There's a lot of bacteria that can cause infection of the cervix, and there are different types of bacteria compared to the bacteria that causes infection of the vagina. So what's the difference? Now I got bacteria here, bacteria there. The bacteria in your vagina usually comes from your own body, usually from your stools, your feces when you pass motion. Or it can even travel because they're so near, right? They can jump from one place to another, so they can travel, they can jump. But most of the infection of the cervix, whether parasite or HPV viral infection, or the bacterial infection like chlamydia, gonorrhea, mycoplasma, ureaplasma, they are all sexually transmitted. So you got it because someone carried the bacteria or the parasite or the fungal and you had sex with him. So that's how you got it. So sad to say, it's all due to that. Alright, so something that a lot of gynaes tend to avoid sometimes. To be very honest with you, this is also a very difficult situation that we get ourselves into, because sometimes if we test it, means we have to tell you that you got it from whoever who gave it to you, who is a man, and that man got it from another woman, obviously, right? So that is why sometimes it's also very difficult for us to break that story as well. And it is not routinely checked. When you get a vaginal discharge, when you go to normal clinics, let's not talk about some gynaes, let's talk about, let's say you go to Clinic Kesihatan, okay, government clinic, or you go to a GP. What they're typically going to do, they're going to do Pap Smear, and they're going to do maybe at the most people only do Pap Smear, but maybe at the most you will get a high vaginal swab. But high vaginal swab and Pap Smear will only give you all the bacterial, fungal for vaginal infection, and maybe HPV, and also the parasite, but definitely not the bacterial infection of the cervix. So a lot of women actually harbor some form of sexually transmitted infection, but they got no idea. They got no idea because nobody tested. So sometimes if you really test it, you will be able to realize that actually quite a lot of us actually have sexually transmitted diseases, which you do not realize. Because nowadays I tend to do it as a routine, especially if I think the cervix is not healthy. I will definitely test for sexually transmitted illness, and very often I get it positive. Okay, that's the reality. Next, other than this, we go up one level, which is uterus, tubes, and ovary. Usually all these, they can be infected at the same time. And the infection is again due to the bacterial infection at the cervix. And I had one case I just want to share. Very sad, very sad, very sad, this case. I think she has discharged all her life, but not say tremendous. But nobody knew anything was wrong with her. Until one day she was pregnant. And then when she had pregnant, she had a lot of discharge, that bloody discharge during her pregnancy. And doctor do not know what to do with her, keep giving her medication to strengthen her pregnancy, but it didn't work, and eventually she delivered at about 20 weeks due to the infection, and the baby came out, cannot survive, and that's it, she lost her first pregnancy. But that didn't end, the story didn't end there. After about 2 to 3 weeks, she had severe abdominal pain, and she went to another hospital, and this time the doctor diagnosed her to have pus collection in the tubes and ovary. So as a result, she needed a surgery to wash all the pus. When you have pus collection in your ovary and tube, which means you have infection of the uterus, tubes and ovary, is usually due to cervix bacterial infection, cervical bacterial infection. So this bacterial infection of the cervix, as I said, is all sexually transmitted illness. But patient was admitted to hospital, given all the antibiotics to cure her. Well and fine, she's cured. But nobody treated her husband. So what happened? I didn't see her the first pregnancy. I saw her only in her second pregnancy. So when her second pregnancy, she came to see me. Same story. Again, this bloody discharge came out again. But when I hear the whole story of what she told me about first pregnancy, immediately the first thing in my head was she has a sexually transmitted illness. So I did a sexually STD test, and yes, it's positive. It's not recurring. It's not recurring. In a way, yes, it's recurring. It's because we didn't treat the husband. We didn't treat the husband. So the husband will transfer it back to her. But luckily, I detected it early. I started her on antibiotic, and she's well for now. But this time, I make sure the husband is treated. You see? So that's why a lot of gynae is sometimes in this dilemma. Because if I tell you it's a sexually transmitted illness, I also worry what's going to happen between you and your husband, right? But if I don't tell you, then I don't treat your husband. Actually, it's not fair, because the infection will come back to you. So, not easy decision to do lah, okay? So that is the one case I want to share with you, because a lot of people don't test for sexually transmitted disease. But even if they know, also a lot of doctors very difficult to break the news. I have seen so many patients who come back with me with reports with sexually transmitted illness, and from other doctors, and the doctors say she probably got it from public toilet. Nonsense, okay? Public toilet is the excuse a lot of doctors will give you to save your marriage, and typically that will be a man doctor, okay? Alright, so okay, I cannot that sexist. I cannot blanket all men. Alright, but yes, this, I mean, you get the infection definitely from your man, whether it's from husband or not, that one is between you and only you know. But my duty as a gynae is to let you know it's sexually transmitted illness, because you need to treat whoever who gave you the infection, okay? So that is infection. I haven't finished yet on discharge. We also got the next part. The next cause of discharge other than infection is tumor growth, cancer. Okay, number one, cervix. As we know, HPV virus can give you discharge, bloody discharge, or blood stain after sex. So HPV virus, we know, is linked to cervical cancer. So from the day you have HPV virus until the day you get cancer, it may take 5 to 10 years. But during these 5 to 10 years, there will be different changes that happen to your cervix, and it's all part of pre-cancer. So these things are supposedly you are supposed to detect this on your Pap Smear. That's why you're supposed to do your Pap Smear every year. Other than that, you can have polyps that grow in the on the cervix. They are not cancer. They are little growth, little growth on the cervix, and these things also can give you discharge. But typically, discharges on polyps, you can have polyps in your cervix, you can have polyps in the uterus. Typically, the the polyps, they give you clear color discharge. So it's like clear color, but sometimes you see some blood. So you see your discharge is transparent, but you see some blood. They normally like that. All this you must understand is usually due to growth, either in your uterus or in your cervix. So these are the causes of discharge. Okay, alright, so I guess I finished everything. So when you have discharge, actually at the end of the day, generally I feel that you should see gynae lah. Because what happens with a lot of women, number one, they go pharmacy because they shy ma, they shy to come and see doctor and take off their pants and show us everything, right? A lot of women shy, so they go to pharmacy. And pharmacy, you don't need to tell anything, but you say I want something for discharge, and you get the pessary. But you must understand that pessary is only for candida. Okay, so it doesn't solve all the problems. So you do not know why you have discharge, you just take the pessary. And then if you go to GP, typically you will also get either a Pap Smear test done, only Pap Smear, or they may do Pap Smear and high vaginal swab. Even in clinic kesihatan, that's all they will do. Even to the pregnant mothers, I see them every day putting high vaginal swab only. So again, yes, at least you're doing something to try to find the cause of your infection, but at the same time, you're actually not really finding going through all the causes. You only test for certain thing and then they test for everything. So sometimes doesn't give you an answer at all, and then you cannot solve your problem. So by right, number one, we need to determine in the first place whether your discharge is due to infection or not. If you tell me you have discharge that is what do you call that, got itchy or itchiness or smelly, then it's a lot simpler, because I know by doing one Pap Smear, settle all problem. Because by doing Pap Smear, I will be able to detect candida, PV, as well as the parasite in the cervix, Trichomonas. Okay, but a lot of other things I say cannot, I don't know lor. So that's why you need to do what do you call that, high vaginal swab. High vaginal swab will be able to detect the rest of the bacteria in your vagina, and we need to look at your cervix, because if we see a polyp, then we know it's due to polyp. Then we do not need to do any tests at all. If we look at your cervix look very red and angry looking, then we know it's an infection of your cervix. Then we probably need to do a HPV test and a sexually transmitted test, as well as Pap Smear to look for the parasite. And we also need an ultrasound scan to look into the uterus to see if you have polyps inside uterus, especially if you're talking about clear color discharge with blood, streaks of blood. So you need a thorough check to be able to find out the real cause of why you have the infection. Okay, all right, I think I have finished everything. So next is going through all your questions. I see so many questions. I love questions. Keep it on, keep it coming. Okay, let's see some of the questions. Ida Osman asks whether the parasite is deadly. No, it's not deadly. It's not really worm, but it has tails. It can swim. Okay, Lillian, I guess I've answered your question. The parasite is due to sexual transmission. It's not worms. This trichomonas is not worm. It's a kind of parasite, but it's not a worm. No, syphilis is another story altogether. Syphilis do not give you discharge, okay? Can we say HPV or cervical cancer is caused by outside sex? What do you mean by outside sex? You mean sex other than you? Okay, yeah. HPV other than you being with your husband, is it? I do not know what Samantha is asking, whether she's asking that question. One thing we know is, number one, HPV infection is definitely sexually transmitted. Why? Because to transfer a HPV infection, you must have skin to skin contact. And HPV is infected in your cervix. What touches your cervix other than the penis? So the penis and the cervix touch each other. That is how you transfer the HPV infection. But we do not know how that person, the guy that you had sex with, whether it's your husband, your boyfriend, whoever, how did he get the HPV? So most of the time, I'm not saying all, majority of cases, he also got it when he had sex with another woman. But it can still be due to other reasons. Let's say he has HPV in his hands. Yes, because HPV can infect skin. It infects skin. So you can have HPV infection on your hands, your fingers. Okay, so if you have had infection of HPV on your hands and he touches his penis, so of course he can transfer the infection to his penis, and then from the penis it goes to you. Okay, but most of the time if you look at the hand, it's fine. Where the hell the infection came from? But there's one thing you need to know about a lot of all these sexually transmitted virus, irrespective of HPV or whatever. Some men can have it a long time ago. A lot of women will come and tell me that, do you mean my husband have another woman? I say, I never said that. But one thing I can say is that the infection can be with him for a long time, even before he knew you. Because I heard one case like that. This lady, she got cervical cancer. So she got cervical cancer and she passed away. Then the husband remarried. A few years later, he remarried another woman. And then this woman, a few years later, also got cervical cancer. So you see, your husband can carry the virus for a long time. He can get the infection even before he knew you. So most of the time when I say that, they are a bit not so angry. But I really do not know. I will know when you got it, where you got it. If you only have one sexual partner, I got no idea where he got it. But it can be due to his hands infected by HPV, but not the other sexually transmitted infection, okay? Definitely not chlamydia, gonorrhea, uroplasma. All this is due to sexually transmission only. Alright, Ida asked, what about GBS, doctor? GBS infection is bacterial infection of the vagina. And GBS comes from where? Comes from your bowel. So whether the GBS jumped from the bowel to the vagina or is due to some of our cleanliness, when we wash, we accidentally contaminate the vagina with fecal material when we wash after passing motion, we don't know, okay? Alright, any questions? Lin asked, what's the combo of antibiotics? We try not to give combo, okay, Lin? So it's best to get it tested to know exactly what, because everything has a different medication. Candida's medication is different, BV is different. If you get the Trichomonas parasite, it's different. Sexually transmitted disease is different. HPV, there's no medicine. So Amy Mashita Azizan asks whether OCP can cause any of this. OCP doesn't cause any infection. OCP doesn't cause any infection at all. But, and in fact, OCP protect you from infection. So OCP has that's why there was this one lady, I remember, she put IUD and she had a lot of infection. Without the IUD, still a lot of candida. I told her, why don't you take the pill? The pill will reduce your candida, will reduce your BV, and also prevent infection from going all the way into your uterus, ovary and tubes. So OCP does help in preventing infection. So that should actually prevent your discharge. Samantha Chi asked, can Pap Smear detect all of this? As I told you earlier, no. Pap Smear can only detect certain things. So every time you have discharge, you go and see a gynae or GP or clinic kesihatan, anywhere you go, they only do Pap Smear, they're not testing everything. Yeah, Chai Lenly asked, is it normal to have discharge but no itchiness or no smell? It's possible, but most of the time you must look at the color of discharge. If it's white and clear, no blood, no yellow, no green, then of course it's normal. But once you have yellow, greenish discharge or some blood stain, that is not normal, okay? Okay, Afida Kasim asked, a gynae in GH said that Pap Smear only done once every 3 years. Which one is correct? Once a year or every 3 years? Okay, depends on whether you're talking about government screening program or your own screening program. Government screening program is every 3 years, unless it's abnormal, then we do every year. But that is provided this is a screening program. That means you have no discharge, nothing. Okay, you're well, you have no discharge, you're supposed to do your Pap Smear every 3 years. This is government screening program. But when it comes to people already have certain amount of discharge, a lot of problems like discharges and things like that, it's not 3 years anymore. You should do it every time you have a discharge or regular basis. Number 2 is, or should you do it every year? In private, most of us do it every year. Why we do it every year is because the detection rate. If you want the detection rate to be 100%, then it's every year. If you're happy with 98%, then it's 3 years once. Government screening program is 3 years once because 98 and 100% is only 2% difference. They are willing to take the chances of 2% of women getting cancer because they have to think about cost effectiveness. If they take the entire Malaysia, every woman do Pap Smear every year, do you know what's the cost like? As it is, we do every 3 years. Do you know that it takes so long, sometimes in the government hospital, in the government labs to get your report? It takes so long for your report to come out. So if every woman is going to do it every year, the labs cannot cope. So we ask women to do 3 years once because we can afford that 2% women with cervical cancer. But if you're talking about you yourself screening yourself for cervical cancer, I'm not going to do 3 years. I'll do it every year. I do my Pap Smear every year. Okay? Because I'm not going to be that 1-2%. I'm not going to take it at 1-2%. After all, Pap Smear is not that expensive. It's cheap. Why want to save the money? No point. Government need to save the money because if they do for the whole country, it's a lot of money. But if you're doing for yourself, then it should be every year. Is Pap Smear really recommended, doctor? Yes, of course. When you have infection, we need to do Pap Smear to know why you have infection. One of the tests that we need to do is one of the tests, shouldn't be the only test, and to prevent cervical cancer. We do Pap Smear, the main reason is to prevent cervical cancer. Okay, Novel NC has interesting questions to ask. Let me see. I get Pap Smear twice every 6 months due to recurring itchy and on vulva. First time Candida positive, second time get negative. Gynae inspected physically, all clear, but it's still itchy every day, especially when have discharge or wet. Discharge is sometimes clear, sometimes white. What else could possibly be the cause? Okay, itchiness. If you have vulva itchiness with hardly any discharge, because your discharge is mainly clear or white. If you have vulva itchiness with hardly any discharge, then we are thinking about other things. One of the causes of vulva being itchy without any infection. Okay, I think in first place, I also still need to rule out whether you still could have any infection. If your Pap Smear only show you Candida, then I'm very sure you do not have the Trichomonas parasite that can also cause itchiness. And I will still want to do on top of your high vaginal swab, on top of your Pap Smear is the high vaginal swab, because I want to look for things like E. coli, because things like E. coli can also cause discharge as well as itchiness, but it's not the Candida, and Pap Smear will not be able to test out anything. And of course, because I didn't see you, there's one more condition that we can detect. That is a skin problem causing itchiness. And this thing is also very often missed out by some gynaes. I wouldn't say all gynaes, but some gynaes may even miss this we call lichen. Lichen, which you want to look into internet, is spelled as L-I-C-H-E-N. Lichen is a condition where the skin of the vulva causes itchiness, and this itchiness is long-term one. It can be there for years and years and years. A lot of women I've seen, many women I've seen for years. And the treatment is months. So if you have only treatment for a few days, it doesn't solve, but you need to be lichen. That one I need to have a look, because when we see, we can detect. But it's not something that I wouldn't say all gynae will be able to detect it. So you have to have but most of us will be able to tell. Because I have seen cases that the lichen was missed when they came and see. Trichomonas tidak membahayakan baby. Yep. Nur Hayati asks whether Trichomonas membahayakan baby. No, okay, it doesn't cause any problem. Lynn asked how to treat PID. I had laparoscopic. Doctor say I had abdominal adhesion due to infection. PID is treated with antibiotic. Okay, but you need to know whether you have PID first before you can treat with antibiotic. Causes of polyp, no real cause. It comes and it goes. It doesn't go, sorry. It comes whenever you feel like coming, just like any other growth. Okay, polyps of the cervix doesn't turn cancerous. Polyps of the uterus turns cancerous. So if you know it's a polyp, we need to remove the polyp, especially the uterus one. Cervix one, no need to remove. Discharge a few days before period, brownish, is that normal? I wouldn't say it's normal. Shan Farm asked that. Shan, I would seriously want to look for brownish discharge. I want to look for endometrial polyp, okay? Polyp inside your uterus. This is something you really need to look hard. Most people, when they do ultrasound, they will miss it. They have to look hard for it before they can find it. Because endometrial polyp can be easily missed on ultrasound. Hepatitis B vaccine is to prevent STD, right? No, sorry, Ada, it doesn't prevent STD. Ada, it does not prevent STD. Emma asked said that her discharge is thick, clear, or milky discharge, but it's not smelly or itchy. That is considered normal if it's like just during 1-2 weeks before your menses, but if it's every day, then I don't consider it as normal. Ho Kim Fong said that one inner lip swollen almost every month during ovulation week and slightly itchy. Is it Candida? Some things that happen regularly during every menstrual cycle. Number one, it can be Candida. Because why? Because Candida is something that is mainly inside the vagina. In some women, they don't have so much Candida, they have little only. If you have a lot, it will all come out as discharge every day, and every day also itchy. But if you have only very little, and because during ovulation, you actually pass a lot of discharge out because of the ovulation, so this Candida actually comes out. So the only discharge or itchiness that goes together with your menses usually is Candida. Xuan Si Liu asks, can endometriosis also cause discharge? Yes, especially if endometriosis affected your cervix. If endometriosis affects cervix, they also produce a lot more discharge because the cervix will be a lot more swollen. Yue Ling asks, how about towels in hotel? No, towels in hotel doesn't give you any infection because they're supposed to wash it. Okay, there's a lot of regulations in hotels where they need to wash all the towels. Nobody's going to give you old towels, so don't worry. Ping Lim asks, Doctor, sorry, a bit out of topic. I really didn't know about Panty Liner is harmful, but I'm taking Vicene now since March and I'm still bleeding. Put on a Panty Liner and pads daily. Yeah, it's normal to have bleeding due to Vicene, but I wouldn't put my Panty Liner every day. Please, in cases like you, what do I usually do, Ping Lim? I usually ask my patients, don't use Panty Liner every day, because then you will eventually develop vaginal infection. So what you need to do is just use tissue paper, put tissue paper and then throw it every time you go to the toilet, okay? Yes, Dia Putri asks, why candidiasis recur even after antifungal pessary? I have already answered earlier on. Okay, there's no use using antifungal pessary again and again, antifungal again and again, if you are not going to change your daily habit. Okay, candidiasis is due to your own daily lifestyle that needs to change. Okay, you can look at my video earlier on. I have explained what are the do's and don'ts to avoid candidiasis. Australia, is it possible for chocolate cyst and endo from our tubes cause smelly discharge sometimes? It's rarely to give you smelly discharge. Usually when smelly discharge, I will still think about infection of the tube. Okay, one thing you must understand with chocolate cyst and endometriosis and chocolate cyst also get infected very easily. Why? Because bacteria love blood. Blood is again their food source, so it's very easy to get infected chocolate cyst also. So if it's infected, then only it will give you this smelly discharge. If not, it doesn't. So you still need to treat your infection. Amy Mashita Azizan asks, during pregnancy, discharge out normal or not? Yes, pregnancy has more discharge, but it has to be white and clear, no color, no smell, no itchiness. Han Yi Tan asks, discharge with yellowish smelly but no itchiness? Yes, that is also not normal. I cannot tell you what it is. You need to do all the tests to be able to find out. You need to see a gynae to answer your question. Okay, there's no way you can tell the difference. I got yellow discharge. Is it from vagina, from cervix? Is it bacterial? Is it viral? Is it parasite? Or is it fungus? There's no way you can tell. You need to do tests, okay? Is it normal to have clear discharge with blood after intercourse? No, dear. Noor Akila Ali asks if it's normal to have clear discharge with blood after intercourse. No, okay? Any blood that you see after intercourse is not normal. Please see a gynae. Okay. Amy Mashita Azizan said, is it normal to have vaginal discharge when you have hormonal problems? In a way, yes, because one of the common causes of hormonal disturbance is PCOS. PCOS women are naturally, if you remember my PCOS talk, PCOS is linked to diabetes, and because PCOS is linked to diabetes, women with PCOS are sweeter, and because they're sweeter, they tend to have more discharge as well, okay? Alright. No, can HPV test replace Pap Smear? Not totally. Depends on what you want. Depends on why you do HPV test. If your only purpose is to prevent cervical cancer, yes. But if you want to look for other things like Candida, trichomonas parasites, you can never find in a HPV test. You have to still do a Pap Smear. When you have postcoital bleeding, Afida, if you have postcoital bleeding and you can do a Pap Smear, and if you still can't find anything abnormal, I will not just stop at doing a 3-yearly Pap Smear. Definitely no, that's very dangerous. Because postcoital bleeding, we always fear about cervical cancer. And you must understand, Pap Smear can miss cervical cancers at times. So we have to do other things, okay? Faith asks whether if I do HPV and Pap Smear, you can do every 5 years. Yes and no. Depends on whether you really want to be 100% preventive or not. If you're talking about cervical cancer, if you want to make sure for 100%, sometimes when you do things like that, 5 years is a bit risky. Why? Okay, this is through my experience. Yes, we always like to say that cancers takes 5 to 10 years before they form. But in now modern times, it doesn't take so long. We have seen women who get HPV infection today, and next 2 years you get cancer. Why? Because certain HPV infections are more we call more fierce, they turn cancerous faster. And the cancer, you must understand, if you want to understand about cervical cancer, it also got to do with your lifestyle. And nowadays women have not so good lifestyle in a way that cause the virus to grow faster. So that is based on theoretical knowledge we had all along about cervical cancer and HPV infection. But unfortunately, that knowledge that we have is like how many decades old already. It doesn't apply to women today. So to be on the safe side, I will still do my Pap Smear every year. Aisha Basira said, just in case we want to get pregnant and our spouse had transmitted disease, do we need to take any injection or pill to protect ourselves? Okay, it's just very simple, because sexually transmitted disease also don't make you pregnant. They actually stop you from pregnant. The infection that stops people from getting pregnant is a cervical infection, which means sexually transmitted disease, because all cervical infection is sexually transmitted. So what you need to do is, if you think your husband has sexually transmitted disease, it's very important to do a cervical test to test your cervix for your virus and bacteria and also the parasite. Find out what infection you have, treat it lah. That's as simple as that. But remember, when you treat, must treat both husband and wife, okay? Hormonal imbalance and stress, tiredness affect the color and the amount of discharge. In a way, yes. Because when you're very stressed and tired, your protective layer of vagina also changes. And that can make you more likely to get infected. Another thing is, the reason why I say that you get more discharge during ovulation and premenses is again all due to the hormones. So if your hormones are all disturbed, your discharges also will change. Okay? Yes. Aisha asked, does PCOS have more discharge? Yes, because they have PCOS. They are sweeter, so they get Candida. I want to ask a bit more about lichen. We really need to look at you. Lichen have to be seen. There's no other way you can do it. Okay, how to cure Candida? Candida can be cured with medicine, but it's temporary. If you want to cure Candida, Sophie, you need to go back to why you get Candida. Your lifestyle need to change, then Candida will go away forever. Okay, Mariam Akmal say, is it normal to have discharge with blood after the Pap Smear? Yes, that can be quite normal, because we use something really hard to wipe on cervix. So sometimes you can have discharge, blood in your discharge after a Pap Smear test. But you can also get infection because of the Pap Smear test sometimes. So if your discharge persists like for weeks after your Pap Smear, it's better you go and see the doctor. Daphne asks, is it recommended to wash down there after sex? Of course you can wash, but just don't overwash. You watch back my video earlier, you understand what I mean by overwash. Alright, Sarah Hashim, you asked about yellow discharge. Yellow discharge is not normal. I never say it's dangerous. Nothing is dangerous in discharge most of the time, but it's just not normal. Okay, so if you are you have yellow discharge, you need to see a gynae and get all the tests done to determine what's the cause of your discharge. Azi asks, is it normal to have discharge during early pregnancy? It's normal as long as it's white or clear. Okay, I've answered all the questions, and many of you are also asking me questions that I have answered earlier on. No problem, you can just watch the video all over again and you have better understanding. Alright, so today that's the end of my video today. Okay, stay tuned this Sunday 9 PM. Bye.